15 seconds.
Good afternoon and welcome to our virtual town hall series, Steamboat Conversations, which is brought to you by the City of Steamboat Springs and the Steamboat Pilot in Today. My name is Lisa Slitchman and I'm editor of the newspaper and I'll be serving as moderator. Today's panel is focusing on Routt County's vaccine rollout. We have received a large number of questions from the community, which indicates strong interest in this topic. So I'd like to introduce our panelists, who I think have become very familiar faces to our audience. And I again thank them for participating. And then we'll jump right into a little bit longer list of questions than normal. So today's panelists include Dr. Brian Harrington, Routt County Medical Officer, Roberta Smith, Routt County Public Health Director, and Sonia Fiedler, President of UC Health Yampa Valley Medical Center. Again, thank you all for being here, and we'll just go right into the questions. First up, Sonia, can you give us a quick overview of how many people have been vaccinated in Routt County and what groups have been vaccinated?
Sure, and I think that Roberta can help answer this as well. I'll focus on what UC Health Yampa Valley Medical Center has done. So as of yesterday, at the end of Tuesday, February 9th, we have administered 2,670 doses of COVID-19. Of that, 1,716 are first doses, and 907 of those have been administered to the 70 plus population. 954 have been second doses, and of that 224 have been for the population of 70 plus. And of course, as we've communicated before, we have to closely follow the approved vaccination tier phase process as set by CDPHE. So the phases that we've gone through so far and that we continue to vaccinate are phase 1A of the healthcare workers, and then phase 1B1 of the Colorado residents ages 70 plus, additional healthcare workers and first responders. And then as of this week, we started opening that up to part of the state guidance, the ages 65 plus. So actually right now we're running clinic this afternoon for that population. Tomorrow we'll be running a clinic for second doses for the ages of 70 plus. And then all day Friday, we'll be continuing to do the 65 plus population, in addition to a significant number of staff from the Steamboat Springs School District.
Thank you. Roberta, what would you add to that?
Yeah, so our numbers that we have up on the Routt County dashboard include what Sonia has mentioned that UC Health has done. We also have other COVID vaccine providers, including Public Health. And total, so we're looking at the data through the Colorado Immunization Information System, and total residents in Routt County that have received at least one dose of vaccine is 3,533. So this is really good news. We are very appreciative of having UC Health as a partner here, because I think we're able to increase the amount of people that can be vaccinated in 1 week. We're looking at, the governor has set a goal of 70% of 70 and plus aged folks in Colorado to be vaccinated by the end of February. It was a very aggressive goal, and we've met that goal here in Routt County. So we have 70% of our 70 plus population that has received at least one dose. So that's really exciting, but we do continue to vaccinate that category. And as we've mentioned before in Board of Health meetings, we move along in different categories of who is eligible for the vaccine. It's like boarding a plane. If your row is called, you can go board, but if you're stuck in the bar somewhere and miss your row, you can still board the plane when you get to the gate. So that's how we're looking at some of our vaccine rollouts in terms of all of these categories that are opened up, and we continue to build on each section.
Thank you. Next question, Roberta, I'll direct this to you. Do you have any information available on when people with high risk chronic medical conditions like respiratory disease will be eligible for the vaccine?
Yes, so the governor had a press release last Friday, and initial vaccine information has been coming out, and some of these stages change from month to month. And again, it kind of depends on ACIP recommendations and also on supply of vaccines. But when the governor opened up to the 65 and plus category for this week, he also presented the whole strategy moving forward. So our next phase is 1B.3. And this next phase opens it up for frontline essential workers and people aged 16 to 64 with one or more high-risk conditions. So a respiratory condition, a cardiac condition, diabetes, there's a list of chronic conditions within that framework that group would be eligible in this next phase. And we anticipate that next phase will be around March 5th, that we'll hear the announcement that we're moving to that next phase. So again, making sure that we're focusing on some of our age categories, some of our occupations now, and then gradually opening that up in March to that group.
Thank you. Let's see, again, Roberta, this next one is for you. And this is a direct question from someone, so I'm using I'm just saying it like it's presented. I've seen elsewhere that vaccine distribution from the federal government to the states is based on each state's resident population. I've also seen that we are willing to vaccinate out-of-state second homeowners, which could be a sizable number of people. Has the county requested additional vaccines to cover this increased demand?
So each week, Colorado as a whole gets an allocation of vaccine. And yes, this is based on the population size of our state. So they get that from the federal government. And then from that weekly allocation, CDPHE then distributes it to the counties. Each week, the counties and all of the COVID providers that are included in those counties submit orders for COVID-19 vaccinations. So we do order vaccine. What we get, it doesn't necessarily match that order all the time. Some of our COVID vaccine providers have ordered vaccine and have not gotten the allocations. Part of the nuance with some of the ordering and distribution is these vaccines are in dedicated packages and for distribution. So the Moderna vaccine, you can only get 100 doses. That's the least amount that you can get. So they're looking at this county by county to make sure that distribution is proportionate to their resident population. And yes, especially in mountain towns, populations can fluctuate throughout the year. You might have more of an influx of homeowners coming in the winter time or even summertime. So we are looking at our interest forms that people have filled out with us to help gauge where we're at and what doses might be needed. Certainly, if someone is a second homeowner here, they're here for the winter, we would want to vaccinate them because they're part of our population and we want to make sure our population is staying safe. And we also want to reduce the burden on our healthcare system here where they are living as well.
Thank you. Sonia, this next question is for you, and it's a little bit long. So what plans and policies are in place to avoid wasting vaccine doses at the end of clinic hours, the end of the day at vaccination sites, So that's kind of the first part of the question. In some cases, at the end of the day, a multi-dose vial is open with doses remaining because a person or person didn't come in for their scheduled appointments. Are there formal plans in place to get those remaining doses in arms and to avoid having to discard doses? And can you help people in the community understand why and how the selection of those last minute people occurs? So it's kind of a long question. So
yeah, sure. I mean, I think number one, our goal is to not waste a single dose. And I think there's also a little bit of art with this. So we're really fortunate to have just an incredibly skilled pharmacy department led by our pharmacy director, Wes Hunter. You've probably heard his name. I know Roberta has shared his name and associated with his mad skills on drawing these vials. So because of that, though, we're able to maximize doses out of every vial. And so consistently, we're pulling an average of 6 doses out of the Pfizer vials and 11 doses out of the Moderna vials. So that's 1 extra per vial that, if done properly, we can pull extras out of. So yes, we've definitely had occasions where just due to an additional dose in a vial or someone not showing up for their appointment, a dose or 2 might remain at the end of the vaccine clinic that day. So in those instances, what we do is we reach out to patients who are eligible, meaning that they fall within the tiers that CDPHE has put out. Maybe they're scheduled in the next few days or at the next clinic, that are already booked for their first vaccine, that they're interested in coming in early. And so we'll call them and we'll just make sure that we go through that list of, and we really do focus on randomly selecting. Oftentimes we'll just kind of do away or figure out a way to look at the list and pick someone randomly. So it's very fair and equitable. And so when we have had to reach out to patients, it seems like for the most part, they're usually very happy to come in a day or 2 sooner for their first vaccine. And so we have been able to make it work, and we'll continue that process and ensure that those who are on that list that are approved to receive a vaccine are the ones that we're reaching out to ensure that we're not wasting a single dose.
thank you. Next question, Brian, we'll address this one to you and also let Roberta weigh in. People 65 and older make up 16% of the population in the United States, but account for more than 80% of the COVID-19 deaths. Why isn't Routt County making this group the main priority in getting the vaccine? Brian?
Yeah, I would actually say that has been our main priority. It's been understood from the rollout of the vaccine that we should first prioritize most vulnerable segments of our population. And so based on age, we originally had a focus on 70 and older. As of this Monday, the state moved that down to 65 and older. So that has been a stated priority all along. I think the numbers that we just told you about kind of back that up. Per census population, we believe we've hit 70% of our 70 and older. That's been a process over the past month or more. The hospital in particular has focused on the 70 and older population. And so I think we've done a good job of hitting that population target, but we're not done. We continue to work at getting more people in the 70 and older. And now that we're open to 65 and older, that opens up a whole new population of extra people. So we're not satisfied with where we are. We're continuing to work on it. But this has been a focus point for all of us in the county. And so I think we've achieved some good results with that, and we'll continue working on it.
Great. Roberta, is there anything you'd add to that?
Yeah, and I also would like to let people know that we work under what the state directs us to in terms of our vaccine prioritization. So yes, we do recognize, and now it's open to 65 and older, so we are focusing on that group right now. But the state really, and they've changed it as we've seen the vaccine rolled out, but they lay out the plan of prioritization, and counties must follow that plan. And we risk any allocation future deliveries if we're going outside of that plan. So that's why we ask for patience. We know everyone's eager to get their COVID-19 vaccine, but we still have to stick to what the state is directing us to do. And they're also, allocating vaccines based on this prioritization scheme that CDPHE has pushed out to the local health departments. So as we move through these and, these stages, we saw a different prioritization just a couple weeks ago. And even prior to that, we had wanted to get more essential workers vaccinated, but then that changed. So we're kind of going with the flow as the governor releases information and CDPHE releases information. But we just are really glad that we have a lot of people that are eager to get the vaccine, and we will get to all of everyone eventually.
Lisa, I did forget one important point. We prioritized vaccinating the residents in our long-term care facilities in the beginning of January. That was one of the very first things that we set out to do. In our county, a majority of the deaths have actually occurred in residents in long-term care facilities. I'm hoping that those efforts with our prioritization for vaccinations with them, which is done in part in conjunction with the Walgreens chain, will result in no more deaths from residents of our long-term care facilities.
Thank you. It's important to share. Next question, Roberta, this is for you. There are likely eligible people 70 and older and maybe others who don't have the internet or who aren't internet savvy and therefore may know little about who offers vaccines and how to get on that list. Is there a way to reach out to those people and ensure that they have an equal opportunity to get the vaccine as well?
Yeah, that's a great question. I might also have Sonia weigh in on their process at UC Health as well. But what we're trying to do as a community and as COVID-19 providers, not only Routt County, but other clinics, is create a consolidated list. So we've got some family practices that have had patients call them and requesting vaccines. So we're in constant communication about people that are interested in getting the COVID-19 vaccine. For those that might not have the internet, if you want to call public health, we have folks that are able to take your information, and then what they do is add it into our interest form so that we have that information in our database, and we share that database, those names of interest, to whomever has vaccine at the time. So if we're not having a clinic for 70 plus and we've got names on there, we'll share that with UC Health so they can call or add them to their list. So either through calling or through the internet, we can get your name on an interest form and share that with our providers that might be needing to fill up clinics with that age group or with that occupation.
Sonia, would you add anything to that about how you all are reaching people in that?
Yeah. So, I mean, I can go into numerous ways that patients or anyone interested can access this information. But I'll start off with the ones, like you said, Lisa, that don't have access to the internet or a smartphone or just don't want to deal with the internet. We know that that's important, and we want to reach out to those patients. So if they've been a patient at any UC Health facility, but they don't have what we call a My Health Connection account. So My Health Connection is an app or a web-based program that essentially is your health portal. So it's what you access to either see your appointments, pay your bills, see your test results, all of those types of things. And so we're using that same platform that we've had in existence for this effort as well. So if they are a patient and they don't have an account, they're already considered to be on the list because they're just in our patient database. And when they become eligible, they'll receive a phone call when it's time to schedule their vaccine. If they're not a patient or have never been a patient of UC Health, and again, don't have access to the smartphone or have the desire to create a My Health Connection account or any of those things, then we do have a hotline, and that is information that we've put out there. I think the paper has posted that, and I can share that information right now. The vaccine hotline for us is 720-462-2255, and then we can add them to the list. And once again, when they become eligible to receive the vaccine, they'll receive a phone call so they can schedule their vaccine. That hotline is open 7 days a week. Monday through Friday, 7 a.m. to 6 p.m., and then Saturday and Sunday as well from 8 a.m. to 4:30 p.m. So, it's been going really well. We had to staff, of course, the hotline before we could get it up and going and live, and we have it live now. And it's a great resource for, again, for those who don't have access or don't have any desire to do it that way. But of course, then we do have the sophistication also through the technology that that the population can use too. And since I have the floor, I might as well go ahead and share that as well. So there's, essentially so that's one way, right? And then if someone does have My Health Connection, and you don't have to be a patient to load My Health Connection, it's a really great app, actually. It not only has those things that I mentioned earlier, but it has links to different articles, health education, just a really great resource of information you might want to search for, different things. And it's coming from the experts. So it's a really valuable resource. So, so through that app, if anyone has that account, a My Health Connection account already established, then they can consider already be on the list, and they'll receive an email and a notification in the app, again, when they receive that invite and it's time for you to receive your vaccine. And again, if they don't have that My Health Connection account yet, they can establish that and they can create it. And also if there's if someone can't do that themselves and they have a caretaker for a family member, the caretaker can also create that account for them on behalf of them. So there's several ways to still utilize that technology, even if that individual is not interested or isn't familiar on how to make that work. So those would be other ways. And then how to access that, of course, if you just go to your app store, you can search My Health Connection and download the app, or you can go to the web-based portal, which is www.uchealth.org/My Health Connection. And of course, if they just do a search for it, they should be able to find it that way as well.
Great, thank you, Sonia. Another question, and I guess, Sonia, you've kind of talked about how you all notify, but is UC Health the only entity notifying people of their eligibility for administering the COVID-19 vaccine? So I don't know who wants to answer that. Maybe, is UC Health the only one notifying people, or is the county also has a process?
Yeah, we work together. We have constant communication, and what we do ask is, you might receive a call from UC Health. It might be from us at the county. It might be, one of our providers, South Route Medical Clinic, might be Northwest Colorado Health or Lions Drug. Answer the phone. And, that was probably our biggest struggle, is calling people and saying, hey, we've got a clinic, we'd like you to come. And maybe people not answering their phone, thinking it was, spam or something. So we're all out there making calls and making sure that all that have indicated interest in vaccination, and if they're eligible within the categories we're currently vaccinating, we're going to either reach out via telephone or with any email that was provided.
And Roberta, just maybe a little follow-up there. So Sonia mentioned the ways to kind of sign up through UC Health. If someone is not going to do through UC Health and wants to go through the county, what is the best way to do that, to make sure they're on a list?
Yep, on our COVID website, COVID-19 Route County website, we have an interest form. So if you click on vaccination information, there is a link to our interest form, and you can fill that out, and that gets submitted to us automatically, and you're added to the database that we are working off of in terms of sorting by eligibility.
Great, thank you. Brian, this next question is for you. What type of reactions have people reported after getting the first and second doses of the vaccine? And are reactions worse after one or the other?
Sure. Our local experience has confirmed what was reported with the original vaccine trials. And I think similar to what we're seeing nationally. We're not aware of any life-threatening reactions locally to the vaccine. Certainly there's been no deaths. What we do hear and see, probably a majority of people have one or more of either body aches, headaches, mild fever, fatigue, maybe pain where they had the shot. Those are pretty typical and maybe to be expected, but they're all transient. I would say that probably the majority of people don't feel much after their first, well, somewhere around half don't feel much after the first vaccination. It does seem to be true that there's a little more of an immune response and therefore symptoms after the second dose than the first one. I would categorize it saying that you might expect some of these symptoms to be present for say 24 hours after your first dose, and then maybe up to 48 hours after the second dose. We've had a couple cases of people with prolonged redness or swelling at the injection site. And like any injection or vaccination, there's a small but real risk of infection, so you could get a cellulitis. It's also possible that the needle could hit a blood vessel and you get a small hematoma there. Those kind of things, though, are not specific to the vaccine. They're more specific just to the process. So far, our local experience, I think, has been very reassuring with the vaccine.
Great, thank you. Again, Brian, this one is for you. How long does the vaccine provide immunity, and does it keep a person from spreading COVID-19? We've got quite a few questions along that line.
Yeah, and this is a pretty key concept. We need to understand that the vaccine was designed to prevent serious disease. And by that, I mean symptoms, hospitalizations, and death. The vaccine was not proven, and the trials weren't looking at this, whether or not you could still spread the disease. So it's still entirely possible that you can be vaccinated, have no symptoms now, and be individually protected from the vaccine, yet could still carry the virus and be an issue for community spread. Now, look, I am excited to hear sooner than later that the vaccine also prevents carriage of the virus in asymptomatic people, but we do need to wait for that confirmation. In terms of how long the immunity lasts, I think I can say for now, at least 90 days, because we now have guidance that says that if you've been vaccinated, you don't have to quarantine if you're in contact with people in that first 90-day period. We are seeing studies now showing that the antibody response lasts 5-6 months out. I mean, understand, we can't measure something that hasn't occurred yet. These vaccines just started their research trials in October. So we're literally only, for most of these, certainly the Pfizer and the Moderna trials, we're only about 5-6 months into it. So at best, we can only comment on that kind of data going out. But in other studies, we do document that the antibody response, for example, to the virus can last longer. There's also cellular immunity that we have to measure. We don't know yet. I think that the vaccine ultimately reduces our risk of serious disease going well beyond some period of months or maybe a year. And we haven't learned yet whether we're going to have a booster shot each year. But as I started out, I would emphasize that there's this issue of personal safety, which is what the vaccines were designed to do to make us safe if we get COVID-19, which is different from this other question of does it prevent transmission? We're still learning about that. And I know we're going to talk a little bit further about the variants, but that's where the variants may come into play a bit too in terms of how long the immunity lasts.
Thank you. Roberta, this is another question we've gotten a couple of times. Why isn't there just one central place where people can sign up for the vaccine and be notified of appointment availability?
Right. And as we've discussed, I think here in Routt County, being a smaller county, it's a lot easier for us to communicate with our COVID-19 providers. So we are starting to consolidate from our smaller providers into one list. So I think that is helpful. And throughout the state, all of the major hospital systems have a different process. So, a lot of those systems were in place already through how to make appointments, just like Sonia explained with the My Health app. So we're utilizing systems that were in place and systems that are developing, if you will. So, like I said, it's easier in a smaller county to have communication so that we can consolidate information. and make sure that we are getting all of the people notified that are interested in the vaccine. I think when we move to a time when we have more consistent supplies of COVID-19 vaccine, you'll see it in your private provider's office, and you can go there for your vaccine, especially as we open it up to more of the general public and some of the other groupings that lie ahead. So that's going to be a lot easier to kind of go to them rather than them come to you when they have supply. And also, we hope that we can have more clinics that are widely available, and we can just have a link where people can sign up for a clinic. Right now, because we're just getting limited supplies, we do need to target to those groups that are currently the priority. And this has just been the easiest way to do that right now. But, we'll be changing our system as vaccine distribution, I think, gets a little bit better in the months coming ahead.
And maybe a little follow-up question. Do you feel, I know at the beginning it was very sporadic, what you were receiving. Are you feeling more confident about the amount of vaccine you're receiving, and do you think it's increasing?
Well, I laugh because we still, we place our orders I mentioned a little bit of the process before. So CDPHE finds out on Wednesdays how much vaccine the state is getting from the federal government. And then the state on Wednesdays has an advisory committee that goes through the orders of all of the providers and then allocates the vaccines. So I akin it to looking at your stocking on Christmas morning to see what's in there. So on Thursday evenings is when we get notice of what's going to be distributed. But I do think it's going to get a little bit more consistent. So the state is moving to a process where we put in all of our first dose orders and our second dose orders, and we let them know, because that's even another logistical piece, is how many doses we need for first doses and then how many for second doses. And before, these were orders that were split up. Now the state is going to be allocating vaccines on Thursdays and Sundays, and they could be first doses and second doses, or just first doses. So it's getting a little bit more, it seems more complicated, but I think it's going to be more of a consistent cadence that we can understand what's coming to us and have some of that more forward thinking process to open up clinics and have those scheduled more in advance than just 48 hours when we know we're getting vaccines. So I think it's going to be more consistent moving forward. The state announced today that they're getting 95,000 first doses over what we have been getting in the past. So we do see some of those systems opening up. There's some allocations to the pharmacy program that CDPHE was taking doses out of that allocation to the National Pharmacy Program. That program is being phased out because they've reached their goal of what they needed to do with long-term care facilities. So that allocation gets back into the general pot, if you will, of doses being allocated in Colorado. So we're seeing increase in supply. So I think that will trickle down to us in Routt County, seeing more consistency in our dose deliveries.
And Lisa, I would add to that, I think we've played on some of our strengths in our county to get vaccine here. We've demonstrated our ability to put shots in arms, so to speak. While the process has not always been as easy or clean as we would prefer, at the end of the day, we get shots in arms, and the state has recognized our ability to do that. In addition, our having the UC Health Hospital here and the leadership with Sonia has paid dividends for us too. The fact that we have a deep freeze freezer here means that we're in the game, so to speak, for the Pfizer product. And that allows us to sometimes leverage it like we last week did, right? We got 975 doses of the Pfizer vaccine. And so those kind of factors we've tried to play up, and we'll continue to use those to leverage to get vaccine for our county.
Sonia, is there anything you can add?
Yeah, so I don't want to underestimate the complexities that that Roberta and Dr. Harrington just talked about. So even if it was easy and clean, and we knew what we were getting with more advance notice, there's still the complexity of the two different types of vaccines, the storage requirements for the different types of vaccines, the time that it takes for the second dose, right? We know Pfizer is 21 days for the second dose after the first, and Moderna is 28 days. So what my team here has to do is play the Tetris game of, we can't schedule maybe a first dose day 4 weeks out from today because that's already a second dose day. And so it is really complicated. And then of course staffing, and then we're also, as I mentioned before, doing this while socially distancing, keeping everyone safe. We have the observation period that we're, monitoring the patients after they receive their vaccine. So there is a lot that goes into it. So outside of, even if we did have this allocation coming to us consistently, which we would love, of course, there's still that complexities of, of scheduling and just organizing and managing the whole administration process. Yeah, and I think just to, add to what Roberta said, it is, yes, we keep seeing that it's going to get better. It seems like it's going to get better as far as notification and some consistency, but that is the issue. And that's hard for us when we want to serve our community. And we don't know I don't know right now what we'll get next week. I know what we have, and I know our plan for what we have, and that's great. But we want to plan for further than that, and so that's what we really hope that our state, and federal administration can get to is just more consistency and just more structure around that.
Great, thank you guys for that perspective.
If I can add something, Lisa, too. Sure. We are working through these logistics of first doses and second doses. And one thing that's helpful to us as providers is if you do get your COVID-19 vaccine, you get that first dose, plan to be in town when that second dose comes up, because as we mentioned with the doses, once you open a vial, you have to use all of the doses in that vial. So we are planning for you to be present at that second dose clinic. And if you miss it, it's going to be a little bit of a logistic difficulty to get you in for a second dose. We'll have to, look at numbers and wiggle people in and move people around so that we can accommodate that. It's not like influenza vaccine where you can show up and say, hey, I'm here for my second dose, or you don't get a second dose of flu vaccine, but it's not individual pre-filled syringes that you can just administer to anyone that shows up in clinic. It has to be planned and it has to be calculated.
And actually, Brian, I might ask you this as well, because I have heard, some people not getting that second dose. What is that second dose important?
Yes, it's important conceptually, and it's important because of the data that we have. Conceptually, and we do this with many other vaccines too. You get a first dose of something, it primes your immune system. The immune system is comprised of making antibodies. It's comprised of cellular immunity, signaling immunity. The first dose primes that, and then the second dose in many cases literally kind of charges that up to both increase its capacity to respond and increase its memory, so to speak. It's possible that we'll learn that with some of these vaccines, a single dose is acceptable. That may vary on age and other factors. But right now, our data tells us it's a 2-dose series. That's what the trials tested, and it was based on kind of their science on the preliminary research too. And it just confirmed that your best response with these 2 vaccines occurred with a 2-dose series. There's still a benefit from a single dose. Probably there's the same benefit if you're off by a few days from the required second dose timeline. But yet you want to stick to that because that's going with the science. That's going with what we know.
Great, thank you. Next question is for you, Brian. I know yesterday it was announced that one of the variants was found here in Routt County. So what do we know about the current vaccine's effectiveness against new variants of the coronavirus?
Right, and I'll start out by reiterating a point I made earlier. And there's really two questions to answer here in terms of the effect of the virus, and that is, how does it affect the personal safety of an individual? And then how does it affect the spread of this virus through our communities? We don't know all that we need to know about the viruses, obviously, yet. So we talk about variants of interest and variants of concern. So the one variant of concern is this B117. Now, some people refer to that as the UK virus. We tend to kind of refer to it as its medical reference. The reason that is of concern is because it does appear that that virus strain is transmitted more easily. But people need to understand at this point, there's no evidence that that particular strain is necessarily more lethal to humans. Now, in contrast, there is a different strain down, and that's the P1 strain. Actually, I gotta make sure I'm speaking right. P1 is Brazil. B1351 is from South Africa. The South African strain has received some attention, and that it appears it may have some resistance to at least the Johnson & Johnson vaccine, but maybe other vaccines. But we really need to qualify that. When they say resistance, so far all I've seen is they're talking about the fact that people may be more likely to get some symptoms. It appears that all these vaccines remain very robust in their ability to prevent hospitalization and death, which are our key endpoints for personal protection. We'll learn more, and it may vary between different ages and so forth. At this point, I don't feel like we should quite overreact to these variants. They could matter. They could matter in terms of spread of the disease. So if this UK, the B117 variant continues to become more predominant in the US, yes, that could factor into the spread of the disease, this R0 value that we talk about. But it doesn't necessarily mean that either we're going to see more fatalities from it or that the vaccine is not helpful with it. But it's possible that if these variants do present some resistance to the vaccines, that it plays into this question of community spread more. So you can get a vaccine, you're going to be personally protected, but maybe there's more of a likelihood that you could be an asymptomatic or a mildly symptomatic carrier of the vaccine. If that turns out to be true, it will heighten the importance of getting as many people vaccinated as possible, both prevent the spread of it, but just because since it spreads so much more easily, our vulnerable people have all the more reason to be vaccinated with it. We currently in the state have had 2 variants documented by the CDPHE. Roberta and I were just hearing this morning the latest tallies. There's been 42 cases confirmed of the B117 variant and 17 cases of the L452 variant, which is a variant of interest, not of concern. The B117 is one of some concern because it appears it does spread easier. I know Sonia would confirm this with me. The UC Health Lab screens all PCR tests for this S gene dropout. If that dropout gene is present, then they do the genetic testing to identify if one of these particular variants is there. In addition, the CDPHE in general around the state is doing surveillance analysis of 3 to 5% of the PCR tests out there to see if they find these variants. So there is an active process to determine if they're present. And then we'll learn more. It plays into this point, as I mentioned earlier, about if there's a variant that spreads more easily, it's all the more important for us to get vaccinated and to do all the mitigation efforts to damp down the spread of this disease early. If you think about it, every time somebody's infected, the virus is replicating in you millions of times. Every single replication is an opportunity for new mutations and variants to occur. So the sooner we can reduce that number, that kind of cycling of viral reproduction, we make a measurable difference in how likely it is to see new variants that could even be more dangerous or less dangerous.
Thank you. That's getting down to closing. I want to throw another question out at you guys. We talked a little bit before we went live about vaccine acceptance. And I wonder if you guys could share maybe your experience with how people are, accepting the vaccine, wanting to get vaccinated. I don't know who would like to start, but I'd love to hear from each of you if you're comfortable answering that.
Well, I can start. We're probably more biased because we're asking for people's interest in the vaccine. So we get all the names of people that are interested in the vaccine and not people that are disinterested in the vaccine. So, we've had over 5,000 submissions in our form. So that's great news. And that's really telling to us that people want the vaccine. The fact that we've reached 70% of our 70-plus-year-olds, that's also great news. And seeing that, we're hitting these marks when we are able to open up those different priority groups and get the vaccine out. So we do not have vaccines sitting around. So that's fantastic. We started this week vaccinating our school districts, and the uptake in those districts very high, lots of interest by teachers to be vaccinated. So I do think right now we're getting all of the people that are able to are eligible for the vaccine and getting it to them. I think when we start opening it up to the general public, we might have to do some more public awareness campaigns, just like we're doing now, to maybe ensure that we are getting the interest in the vaccine and we do have good vaccination levels throughout our county. So we'll be assessing that as we go along, because we do know there are some folks that are vaccine hesitant, and we want to make sure that we're reaching them with the appropriate information and answering their questions to help them make decisions as well.
Good. Sonia or Brian?
Yeah, I think what I wanted to share as actually part of my closing was just that there has been an overwhelming, significant number of our staff and providers who have been interested, and they do believe in the science behind the vaccines, and have received it to protect themselves and contribute to the health of our patients and our community. So as of probably around the end of January, we had 22,000 staff and providers within the UC Health system who have received their first dose, and 20,000 who have already received their second dose. And so, I think the numbers speak for that. And I do think here locally, we probably saw a higher acceptance rate than the system as well. So it's very, good to see and exciting to see. And I think also, when we talked about a little bit of the stragglers of healthcare workers who are still out there, who are haven't received their vaccine yet, they're doing their education. They're talking to the right people, and they're following up to make sure, as Roberta said, that they're doing it informed. They're making the decision informed with the data and the support that they need in order to make that decision. So we encourage that. This isn't, something that we want people to just to do. We want to make sure that they're comfortable with that decision. So, making sure that they're talking to the right people, their providers, and really the experts around it, not necessarily the media or different, sources that are not reliable, but really trying to seek out those reliable sources that will help them get to that decision point.
Thank you. Brian?
Yeah, it does appear that our vaccine acceptance here in Routt County is strong, and that's reassuring. I think that, that comes down to messaging and getting information out and repeating that. It's also part of the concept in general of how we, talk to people about vaccines, other vaccines. And at least three of the key points for most people involve either lack of information, incorrect information, or the emotions around what is an important decision. So, for those of us in, say, primary care who live vaccines every day with our practice, a lot of us have come to kind of understand that we have to meet patients where they're coming, meet them where they are as they approach these issues, give them information, give them time sometimes to process that information, but be consistent with what the facts are, and to, again, repeat that. Sometimes it can take a few visits with a patient or conversations with somebody. But I have found in my experience, that's usually a successful approach. And I think that we're finding that here locally in our community too, that as we've had this vaccine rollout over the past couple months, certainly with communication efforts, in part with what the newspaper has done and others, that we've increased the knowledge by people about the COVID vaccine, been able to answer a lot of their questions and also help them feel more comfortable and less fearful, if you will, about a new thing.
Thank you. That brings us to the end. So I will let each of you kind of provide some closing thoughts. So Roberta, how would you close out today?
Well, thanks, Lisa, for hosting this session. I think it's needed for our community, and it's great to hear all the questions that are out there. And as we open up different levels, we will be communicating all of the availability through the Board of Health meetings. We'll also reach out to you to make sure that everyone has the information that they need. We'll also be posting it on our Routt County website. But I appreciate everyone's patience with us as we roll through this process. And I just want to say thank you to all of our COVID providers out in our communities. It's been a great team building exercise and just a great way that we can pull together as a county and make sure that our residents have the resources that they need.
Thank you, Roberta. Sonia, how would you close this out?
Yeah, so it's been a long, exhausting year, and this is a place that I don't think any of us would have ever thought we would be. I don't think when this pandemic started, we would have thought that within the same year we would be talking about vaccines. So super grateful to be here, and as Roberta said, working with amazing, talented individuals and within all of our partners. It's been tremendous, and we are all just so pleased to be serving our community. I just want to really reiterate that we are going to continue to do what we do following those CDPHE, the state guidelines on how we administer these vaccines is going to be what we stick with and what's important. And as that changes, we will flex and adapt to that. So as Roberta said, thank you for everyone's patience, and we ask that you continue that. I think the good side, back to the acceptance, is that we do have the demand, and it is a good problem to have, but right now we just don't have the supply to meet the demand. And so we are asking for that patience and really just reaching out, for questions and education, and again, to express interest as these move forward. But thank you. Yeah, thanks for hosting this. And, if anything else comes up, we're here to serve you, community, and please don't hesitate to reach out to us.
Thank you, Sonia. Brian.
It may sound repetitive of Sonia and Roberta, but I think 3 words kind of summarize things: rose, confidence, and patience. I've in another forum kind of mentioned my family. My wife likes to do this rosebud and thorn discussion at dinner time, where you'd say, tell me about your bud for the day, your rose, for whatever. I mean, the vaccine is a rose, right? We can really be excited about this. It's a positive story, and it has a lot of promise to it. The second thing is confidence. I think our experience here with the vaccine just reconfirms or confirms what we already knew or expected to find from the trials and all. I have a lot of confidence in both the safety of this vaccine and its effectiveness. And we'll see more data to support that. And then the third word, patience. Sonia mentioned this. We just ask everybody patient. We're working hard. We're trying to get it figured out and get shots in arms as fast as we can, as soon as we have the vaccine in hand. So those, I think, are my 3 words: rose, confidence, and patience.
Thank you all very much. Once again, I really appreciate the fact that we have local leaders in our community who are willing to participate in these forums and answer community's questions. And, Sonia said it, I like to believe the Steamboat pilot in today is a trusted source. And so I know we have held now, I think we might be up to 35 of these virtual town halls, and I don't know of any other community that is doing anything like this. So, and the purpose of this is basically to have the experts available to our community to answer those questions. And that's where we need to be getting the information. And so we'll continue to do that. We'll continue to report on COVID-19. People tell us they're maybe tired of it, but we will continue to report and get that information out there because it is vitally vitally important for us to get back to normal one of these days. So again, thank you guys very much for taking time out of your busy schedules to be a part of this forum. Our next panel is going to be 2 p.m. Wednesday, February 24th. And as usual, if anyone has any topics that they'd like for us to consider to cover, please send that to news@steamboatpilot.com along with your questions. So thank you everyone for tuning in, and enjoy the snow.
Thank you, Lisa.